questions in chat.
Hey, Deborah.
Hi, Greg. So talking about knee issues,
Mhm.
I have my knee, like I can feel the grinding and inflammation in my left knee. I don't know exactly what I did to start the issue, but I know that I have probably made it worse with like a bad position in an aerobic class. And then at the same time, I have an ankle that is really flaring up. And both of them come and go, come and go
Are they on
over
the
the
same
last
leg or on opposite legs?
same leg. And it's like my bad leg. That's where I have all of my injuries. That's where I've had my ACL replaced. That's where I've torn muscles. It's always that leg. And it's always like from my knee down. That's actually the side where I got hit when I was crossing the street, got hit by the
Oh,
moped.
wow. How long ago was that?
The moped was in 2019, August. That sent me flying in the air and landing on my head. And actually, I felt when I first started working with you, a lot came out in the foot area that felt like it was related to that accident.
And are you prone to the tibial band issues or anything like that? Like the outer part of your thigh?
Uh, Not that I really know of, except for that I am extremely tight. I had the psoas problems, which I think I've worked through a lot. And uh I'm not riding as much. Although, when I ride, I'm traveling right now. I'm in New Orleans at my mom's, and so I've been riding a couple of days, and my knee is not bothering me when I do that. So the tightness is usually has been like lower back, hips, all that related to the psoas. Not really feeling that so much, just tightness all over, and doing like yoga positions to loosen things up.
So popping and like grinding behind the kneecap.
Yeah. I know that when I got my ACL replaced back in 2008, he said he went in and scraped my meniscus a little bit then, that it was torn slightly. And arthritis runs in the family for the knees, so but it's strange that it's coming and going. It's not
Yeah.
constant.
Do you get pain on the side of your knee?
Yes.
Yeah. So when he was doing the surgery, did he talk about your popliteal muscle or tendon?
No, he was not very
I think you have
informative.
popliteal tendonitis.
Oh,
It's this little tiny muscle that it doesn't get aggravated in the general public. Usually, like a runner, a cyclist, a tennis player, a soccer player. Somebody who's like running and stopping, or just does a lot of running, or the cycling, and it's part of the up motion, like when you're cycling. And so the tendon and sheath can get irritated, and it can cause some of that. So part of what you want to do is you want to treat the hamstring a little bit, especially the lower hamstring. And it's like the backside of your knee. So like where the crease is, I would do a combination of Like if you had arthrocare, you could use that, but I would use a combination of equal parts helichrysum and eucalyptus citrodora,
Okay.
and apply it to that knee 2 to 3 times a day, even if it's feeling good, 2 or 3 times a day. And the issue is that when that starts to develop tendonitis, it actually can be tendonitis or it could be called tenosynovitis, because the area where that's happening, it will impact the synovial fluid in the bursa sac. And so what happens is you're not getting quite the lubrication on the tendon and sheaths. So it's like a dry tendon sliding on a sheath, and it feels like gravel. Like, you know what I mean? It feels
Yes.
like and then sometimes it won't, like you said, like you know, you're fine and sometimes you're not. And so like that would still be kind of more of an acute phase. It's rarely diagnosed, like rarely diagnosed. And I mean, usually it's a sports orthopedic guy that will find it. And you know, the treatment is usually just like massive anti-inflammatories, and you stay off of it for a while, which, you know, it's hard just to not do anything for periods of time. And so I have found that that combination of the helichrysum and eucalyptus citrodora used consistently for a while can actually undo that. To treat the hamstring, you know, it's a weird thing. Like sometimes stretching it will actually make it worse, you know, because it has to be a really passive stretch. And so do things that are like kind of antispasmodic, or like open up the fascia. So like peppers or wintergreen, or, you know, even marjoram can be helpful, but I would probably lean more towards like wintergreen or, you know, black pepper or something like that on your hamstring, like not so much on the knee, a little bit above the knee and then up.
Okay. On
Yeah,
the back side.
yeah, yeah, yeah.
And I have pepper supreme.
Yeah,
I don't think
perfect.
I have.
Yeah, perfect.
Okay.
No, that's perfect.
And that's all of this is probably affecting the ankle, or that's just
Yeah,
coincidence.
it's probably all part of the same thing. Like if you want to treat the ankle, I mean, if you have the helichrysum, eucalyptus citrodora already mixed up, put it on the ankle. But like, yeah, I think if you stabilize the knee and the leg, the ankle will fall in place.
Great.
Yeah, I mean, you never know, but um, you're not like getting a change in your shoe size or your arches falling or anything like that.
No.
Okay, I would just treat the knee. Yeah, I mean, reduce the pain in the ankle. Don't get me wrong, reduce the
Right.
pain, but I don't know that focusing on the ankle is going to do a whole lot. You got a significant thing happening in the knee. It's probably causing the ankle issue.
Well, I find that when I don't favor it and I just kind of walk through the pain, that the
Mhm.
pain goes away.
Yeah, 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 yeah. There's a thing that like when you start favoring it or you start losing muscle tone, there's a thing called tarsal tunnel syndrome. And, you know, it's just like you're kind of moving off your arch, or you're not having it be so much weight bearing. And it's just this chain reaction stuff that happens. You know, it's never a thing to where like, oh, walk through the pain, but this is kind of might be one of them. But it's like you just want to keep your gait as normal as possible, and if you stabilize that knee, like everything else should probably fall in place.
Thank you so much. It
Yeah,
makes
yeah.
so
Keep
much
keep
sense.
yeah, keep me posted though. Keep me posted.
Will do. Thank
Yeah.
you.